The first seizure was brought on when he was about 15 months old, and it was a heartbreaking experience. And from that moment on, I just became set on educating myself about epilepsy, looking at all of the treatment options, meeting with multiple doctors, and really just diving into this journey that was set before us. He was on medications like phenobarbital, he was on trileptal, he was on clonazepam, he was on, well, he still remains on levetiracetam, which is generic for Keppra, and does very well with that and has outgrown his dose. And his doctor's comfortable with removing the medication. But we'll get some labs done, make sure everything is going well. And I don't want to remove that last med. But it was very challenging because we just seemed to be chasing the dose every time there was a breakthrough seizure. I would call the doctors, or we would go in for the visit, and I would report that he's having seizures. And like I said, he had multiple seizure types, which I didn't really understand at the time that could happen. Sometimes people think seizure and they kind of lump everything into one category, and they think either it's, the very grand mal type seizures. But he really had a variety of them. He had drop seizures, non-convulsive status epilepticus. Even after the seizure, he had the paralysis. I think it's called Todd's paralysis. So we really had so many different seizure types that we were working with, and the location of the seizure activity would move to different parts of the brain. And so I was so concerned about that, and he would have constipation and skin issues and irritability, and it was just horrific. It truly, truly was just absolutely horrific. I didn't feel like I got answers when I went to see the doctors. I just felt like they were chasing the dose. If there was a breakthrough seizure, oh, well, let's just up the medication. If there was I would go in for another visit and we're still seeing seizures. Okay, well, let's get labs done. And I would ask to try to understand, what are you getting labs done for? And they said, oh, well, to check and make sure that he has a therapeutic dose in his system. So I just didn't understand that. That just didn't make sense to me, is just continuing to increase the dose or try another medication. Everything felt like they were just throwing spaghetti at the wall and just trying to see what stuck, but they didn't really understand why he was having seizures, or making sure that the type of seizure he was having was being medicated by the right medication that showed efficacy for that specific seizure type. One day in the hospital, I think they put him on a lot of Ativan. And so he was just laying in the hospital bed, just unconscious. And I asked the doctor, what are our options here? What can be done? Because we've tried multiple medications. I think at the time we were on 4 medications. And I said, where do you think we go from here? And at the time, I didn't really know much about diet therapy. And I had just heard whispers about it, that it might be a viable option. And so I just asked the neurologist and what he thought, since, we're in the hospital, he's having cluster seizures, one inside of every hour. And he said, well, we'll take a look at other medications. And that just didn't sit well with me. And I said, well, what about I heard about diet therapy. what do you think about diet therapy? I don't really know much about it. And he said, oh no, he would have to be having more than 100 seizures a day for us to explore diet therapy. And in that moment, my gut said to me, this was not right. I don't know what the right answer is in this moment. I don't have the education, but I know that that answer was not right for Nathan. I just looked at my son in the bed, just unconscious, and I thought, what is the difference of the quality of his life if he's just laying here in the bed? He would be laying here in the bed if he was having 100 seizures a day. So at this point where we are, why can't we explore other options? So I just thought, I don't know what the right answer is. I know that answer was not the right answer. So if he wasn't going to allow us to explore diet therapy, I knew I had to find somebody who would. When we started diet therapy and I noticed an improvement in his eating, he started feeling alive, just looking alive. He started coming back and improving. And I also started to read more. I started to look at the side effects of the medications. And at one point, I discovered that reading the side effects of the medications, that some of the side effects of the anti-seizure medication was in fact more seizures. So then I said, since he has become stable with this diet therapy, we're starting to see some seizures again. And I just learned, because it wasn't explained to me completely, the side effects of each and every medication or the interactions with the medication. That was another thing. The interaction was not explained to me, which I think is very, very dangerous, because I think it was one time I had to issue rescue meds. Diazepam, I think it was, because his seizure was lasting more than 5 minutes. And so I gave the diazepam rectally, and he let out a wince and stopped breathing and turned blue. I didn't understand the risk of what just happened. I didn't know what happened. We had to call 911. They came. And through that situation, I learned that there was an interaction with the medication that caused respiratory distress. And I was just baffled. I was like, why wasn't this explained to me? You're giving me this medication, this emergency medication, but you never explained the risk factor that I possibly could have endangered my son's life by trying to stop more seizures, and so the medications were just dangerous. And with experiencing things like that, I just became more determined than ever to really get him as healthy as I could and reduce the medications, which is what we did. I learned about the diet therapy. It was a evolutionary process. We started gluten dairy free, and that journey, just that alone, stopped his cluster seizures. He used to have like 4 cluster seizures inside of every hour, and that was a day, on a daily basis. And just removing those 2 things stopped his cluster seizures. Not overnight, but it took a little time and consistency. But that was the confirmation that I needed, that diet therapy worked, and how important it is to know what we're feeding our children has an effect on their overall health. I just kept learning and trying to understand. And I met some really amazing people. I met other people. Thank God for social media today, because I ended up meeting other parents that had done what I wanted. They had stopped their children's seizures. And so again, it was confirmation. So then I also thought to myself, well, if this doctor's not going to help me, I'm sure I can find another that will. And so I did. I set out to look online for a different neurologist. And so I did go to another city and found a different neurologist at the other children's hospital. And she was very compassionate. And she said that my reasoning, my concerns about all of his current medications, because we had seen time of his improvement, that they in fact could be causing the additional seizures. And so she helped us wean down and off most of his medications. I was also doing a lot of research. Thankfully, social media, YouTube, a lot of experts, neurologists, nutritionists, scientific researchers, they're putting their symposiums and conferences on YouTube. And I watched so many of them. And I'm so grateful that they do that, so that parents like myself can learn, and also they've published books. And I bought all of those to read, and audiobooks. And so I just really dove into educating myself and trying to connect with people in the field. And so thankfully I was a part of this initial study. It was a study with the low glycemic diet, and some really great nutritionists. Beth Zupikenya was a part of the study. And so they were so helpful in really helping us understand the method of diet therapy, how to do it, and things like that. So that was the initial part of my journey with understanding diet therapy. All of the doctors that we had seen never once mentioned that study to me. I found that study because I was connected with the foundation and parents that were reading everything that had been published. I learned about this study and I thought, well, this is amazing. This is really amazing. This is the avenue that we need to go to. It's been a challenging, winding journey, but that's life, right? For all of us, we're all trying to maneuver the best that we can. But I would say do not give up on diet. When you have things like acid reflux, when you have constipation issues, when you have GI issues, it is so important to address those issues through diet. Sometimes people get overwhelmed with thinking diet therapy, the ketogenic diet, have to measure my food. Please don't get overwhelmed by it. Just take it one day at a time. Take it one meal at a time, one snack at a time. If you mess up, it's okay. Just get right back on it. Since our journey has been quite long now, we're over 10 years seizure-free, and I learned so much, and I'm absolutely so grateful to everybody that has helped me learn everything to get to this point where Nathan has been seizure-free for over 10 years. I feel like I have a sigh of relief, every single day, where it's like, oh, thank goodness he's doing well. He's healthy. I have not had to go to the hospital and battle with these seizures, because that's really what it felt like. And I was full of anxiety. So now I feel like I can exhale.